that? Must have been a mosquito!
It is a disease caused by an infected mosquito carrying the Plasmodium parasite. It is common among travelers of the sub-Saharan Africa and South Asia, with roughly 1,700 cases in the United States every year. An infected mosquito carries the Plasmodium parasite, which is released in your bloodstream when bit, then travels to your liver when they mature. The mature parasite then enters your bloodstream and begins infecting red blood cells.
Malaria is transmitted by the bite of an infected mosquito. There are 4 types of malaria. An infected mother can pass the disease onto her unborn baby during birth, also known as congenital malaria. Malaria can be transmitted through blood, therefore it can be transmitted by organ transplant, transfusion, and sharing of needles and syringes.
I feel so itchy. And why is it so cold? And why do I feel so nauseous?
Symptoms of malaria typically develop 10 days to 4 weeks following the infection. It includes shaking chills, high fever, profuse sweating, headache, nausea, vomiting, abdominal pain, and diarrhea.
Hi, doctor.
Hi, how may I help you today?
Well, lately I've been getting like really chilly lately. And I think I have a fever. And I also have like a rash on my arm.
Have you been to any tropical countries lately?
Well, the other week I went to Vietnam, that's about it.
Did you happen to bring any bug spray with you? There happens to be a lot of mosquitoes over there.
Unfortunately, I didn't bring any.
Sorry to break it to you, but you might have malaria.
A doctor will review your health history, including recent travels to tropical climates. A physical exam determining if you have an enlarged spleen or liver will be taken. Blood tests will be run to conclude if you have malaria, what type of malaria you have, and if the disease has affected your vital organs.
The effects of malaria include swelling of the blood vessels of the brain, fluid in the lungs that causes breathing problems, organ failure of the kidneys, liver, and spleen, anemia due to the destruction of red blood cells, and low blood sugar. How will I know if I have malaria or not?
We're going to check your liver and spleen for damage and run blood tests.
What are the blood tests for?
The blood tests are a way to check if you have anemia and to check your red blood cell count.
What type of malaria will I have?
You'll find out after the test.
Your doctor will prescribe the medication based on what type of parasite you have.
Ow, 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 ow. On the other hand, the long-term effects include people with malaria who receive treatment typically have a good long-term outlook. Cerebral malaria, which causes the swelling of blood vessels in the brain, can cause brain damage. Patients with drug-resistant parasites have an outlook much more poorer with more complications.
There is no vaccine available to prevent malaria. When traveling to areas where malaria is common, ask your doctor to prescribe medications to prevent the disease. Sleeping under a mosquito net, applying bug spray, and covering your skin will also help.
Man, I should have used this supreme bug spray. Never again, malaria.